back to Hudson Health. My name is Dr. Ije Lazo, and I'm with Ije Health, and I'm here with my co-host, Dr. Akunyili.
Hi everyone, I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, facility of Health. And today we have the incredible Dr. Emily Martantz. She's an obstetrician and gynecologist with us here at Jersey City Medical Center. Really excited because we have a lot to talk about. Everything from pregnancy to the other spectrum of the woman's health, which is menopause, perimenopause, a lot of questions. We just finished Women's History Month, so this is very exciting that we get to talk about all this with Dr. Martantz.
Very exciting, and not just as Dr. Martantz, an OBGYN specialist, but she's actually one of our top academic doctors as part of our academic practice, which is actually very interesting. And again, she's going to elaborate on a lot of the new technologies, delivery. We are going to separate the segment into OB, talk a little bit about that. And then we're also going to talk about some GYN, perimenopause and so on and so forth.
So we'll talk babies and then we'll do gynecology.
Absolutely.
Very excited.
We're going to cover the whole spectrum. And she's going to fill us in on all the advances and the surgical procedures going on at Jersey City Medical Center.
That is correct.
So without further ado, let's take a quick break and let's bring in Dr. Martantz to speak to us. We'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
I've got cancer.
We've got the highest level of cancer care.
The latest clinical trials.
Researchers working to find a cure.
And nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated Comprehensive Cancer Center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Welcome back, everyone. I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of Health. And I'm here with my co-host, Dr. Ije Lazo.
Hi, everyone. My name is Dr. Ije Lazo, and I'm with Health at Exchange Place here in Jersey City, board certified in internal medicine. So today we're going to be talking about Dr. Martantz.
Yep.
And again, we're going to do two segments. We're going to be talking about prenatal care and how important that is. I mean, we understand that women are really joining the workforce. They've always been in the workforce, but women are a lot more career-oriented, which is incredible to see. And families are becoming double income, And again, the women are typically the ones that not just take care of the kids, but they take care of the husbands too. I know that because I'm a primary care specialist. So
I will not disagree with you.
But it's so important, the prenatal care, everything going on, what a woman can do, the importance of that. We're going to talk about genetic abnormalities. Everything has changed now. Women are having babies a little bit older, and at a certain age group, they're at high risk, so to speak. And she's going to be not just talking about some of the advances in procedures, but as far as genetics and screening for fetal abnormalities and so on and so forth.
Yeah, we'll have Dr. Martantz take us on the pregnancy roadmap, how to prepare for pregnancy, the journey during pregnancy. And for those women who do have complications, all the services available at Jersey City throughout that span. And I agree with you, women usually, and I know that because I have to get my whole family to the doctor, so it's very important that women's health in general is sometimes the only entrance to our healthcare system, and we acknowledge that.
And it's not just about reproductive health. You know, it's also after reproductive health. You know, what happens after reproductive health? And the perimenopause phase and the menopause phase.
Yes.
What does that include? Who gets really affected?
Yes.
What can you do? And so on and so forth.
I think that's important. I think it's important to talk to her. It's such a taboo subject in our society, and we're trying to sort of open and make people more open to knowing the hormone therapies, the possibilities, the treatments, and how the body changes during that period, and the services we can help a woman to live a happy, healthy life for however many years.
And again, she does OBGYN, but again, the relationship, you know, with neonatologists, with pediatricians, you know, is essential. And that's exactly what you get at Jersey City Medical Center. You know, you get the full gamut of care, prenatal all the way to neonatology, pediatrics, and the whole 9 yards. So it's very exciting. It's actually very exciting for our community.
Well, two things we talk about, right? It's very important for us that we have such a wide footprint, so there's a lot of access points for our community, and also times, right? Whether you work late and come back to work and need to see your doctor on the weekends, but that we have locations all through the county, so different people living in different areas can have access to this care.
No, it's very exciting. I'm really excited about hearing even some of the new surgical procedures. I mean, I remember when I started in medical school back in the day, you know what I mean, where it was everything was either, you know, vaginal deliveries or C-sections, for example. You know, and now they're doing transvaginal, you know, hysterectomies and so on and so forth. I'm excited about hearing some of those procedures and some of the technology. And I wonder how AI has actually made it into OBGYN. I guess we're going to have to find out.
We'll have to find out. Stay tuned.
Yeah, stay
We'll
tuned.
be right back.
Jersey City Medical Center has a passion for heart health. We're Hudson County's only full-service heart hospital, with innovative technologies and premier cardiovascular physicians, a partnership with Rutgers Health, the latest technology and medical advancements, and nationally renowned care for every heart in every community. Whoever your heart beats for, our hearts beat for you. Jersey City Medical Center.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and launch inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Hi, everyone, and welcome back to Hudson Health. My name is Dr. Ije Lazo, and I'm with RWJ Barnabas Health at Exchange Place, internal medicine doctor, and I have here my colleague, my co-host, Dr. Akunyili.
Hi, I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a facility of RWJ Barnabas Health, and we have with us today Dr. Emily Martantz, an OBGYN and geneticist. So tell us more about yourself and welcome.
Absolutely. Thank you for having me. My name is Dr. Emily Martantz. I'm a board-certified OBGYN. I'm also trained in medical genetics. I also participate as Associate Program Director of the OBGYN Residency Program at Jersey City Medical Center. I see patients at the Grove Street Women's Health office.
Right outside the PATH station.
Yep, we wanted to make it accessible to all women.
It's fantastic. So can you please tell us, Dr. Martantz, you know, we've talked a little bit before the show, what are the services available specifically? I know there's a big women's health program, but
Sure.
to pregnant women at Jersey City.
Absolutely. So I love the Grove Street location because it's really a 2-floor effort, because on the second floor we're seeing every pregnant patient, And then on the third floor, we have our ATU, or antenatal testing unit, where we're doing ultrasounds on all the patients that we're seeing on the second floor. So really, it's a kind of a full experience for the patient. I'm also doing genetic counseling and genetic consultations for these patients that need it for a host of different reasons. Our practice is growing and blossoming, and we even have a breast specialist who comes in and sees patients as well.
That's fantastic.
No, it's incredible, very exciting. But especially as being a specialist in genetics, you know, this is really important, especially for women with pregnancy, obviously, for obvious reasons. And again, like you stated, there's different reasons to actually get testing. Women obviously are having babies a little bit older nowadays, and again, I know that's changed. Not everybody is straight to an amnio nowadays. We have other modalities. Can you elaborate about the genetics and how's that
Absolutely. So I actually think that genetic screening should start before pregnancy. Anyone who's reproductive age and is considering having children in the future, we do something called carrier screening. So even before you find the love of your life, you know if you're a carrier of any genetic mutations that might have some consequences to your pregnancy. So I like to tell my patients, if you're in your 20s and you're thinking that you might have children in the future, we start genetics then. If a patient has a family history that's significant for something like cancer syndrome or any host of other syndromes or diseases, we offer genetic screening for that. And then when a patient is pregnant, at about 10 weeks, we do something called cell-free DNA screening. And it's a really wonderful technology that's only blossomed in the last decade. And at 10 weeks, we can tell you if your baby is high risk for Down syndrome, trisomy 18, 13, a bunch of other conditions. And patients really like that we could tell them if they're having a boy or girl.
And this helps the family get prepared.
Absolutely. I mean, my goal and my personal motivation is to make sure that not only that a patient is pregnant and has a successful pregnancy, but the baby is healthy at the end of it. And this genetic screening that's done at 10 weeks, it really lets us prepare for any kind of hiccup that could come along the process and make sure that we guide the patient to the right resources.
So speaking of pregnancy, let's talk about risk in pregnancy, which is actually very important. And that's really what most women are concerned about. What are the risks for
Absolutely.
the baby?
So I had a mentor in medical school that called pregnancy a stress test because basically your body is going to be pushed to the limit. And if any predisposing vulnerability, blood pressure, diabetes, it's going to rear its ugly head in pregnancy. I really believe that pregnancy is completely an individual process, and we make sure that we look at your pregnancy in the unique situation that it is. So it's really about identifying the patients who are at risk for certain issues to the baby, to the mom, and making sure that the whole pregnancy and the delivery goes safely.
Is that what they consider like a pregnancy roadmap?
Absolutely.
Tell us more about that.
Absolutely. So we have in every OBGYN, in their mind, they have sort of the basic timeline for when the different screenings are going to take place. When is a patient going to be screened for diabetes? How often are we going to be doing urine samples? But what I really like about this roadmap is that we really make sure that we personalize and individualize it, because not everyone can wait to be screened for diabetes at 24 weeks. We might need to do it earlier. And I think that if a patient knows what the basic timeline is and why we're doing certain things earlier or more frequently, they'll understand their own risks, and so it could really become a partnership.
That's phenomenal. And you do take care of women of all ages, so we're going to talk after the next section really about the other spectrum.
Absolutely.
But tell us more about, you talked about cancer syndromes.
Yes.
Can you tell us more about those cancer syndromes that can be picked up in genetic testing?
Absolutely. So, we have the genes that everyone's kind of heard about, the BRCA genes. I call them jokingly the Angelina Jolie gene, because she wrote a whole New York Times article about how that has affected her life and the surgeries that she's had because of it. But anyone who feels like they're a little bit anxious about their family history and that they know that their aunt had ovarian cancer or breast cancer, I think it's so important for them to raise this concern to their doctor, particularly their OBGYN, so that they can refer to me. And I take a full look at their family history. We draw a nice little pedigree, and we see what is the likelihood that there is some kind of pervasive cancer syndrome coming through the family that would increase the patient's risk for certain cancers. And by identifying these patients, we can do preventative screening earlier and maybe even more aggressively.
No, the interesting thing is that, again, you're dealing not just with the baby, but you're dealing with the moms as well.
Absolutely.
So you're dealing with toxemia pregnancy, which is, mothers that are starting to have issues with, spilling protein, their blood pressure is high,
Yeah.
they're swelling, their risk for eclampsia, which means seizures and so on and so forth. And you even mentioned the gestational diabetes, which from my perspective, from primary care, both hypertension or preeclampsia, those complications as well as gestational diabetes have implications later on in life.
Absolutely. I think that's why I love OBGYN, because first of all, not only do we follow a woman from adolescence to menopause, but we also almost have two patients at the same time. And every OBGYN will tell you that our goal is healthy mom, healthy baby, and hopefully a rewarding experience in the delivery.
Well, you brought in that word menopause, and we're going to break for this segment right now. We're going to come back and we're going to talk a little bit more about the GYN aspect of it. So we'll be right back.
I've got cancer.
We've got the highest level of cancer care.
The latest clinical trials.
Researchers working to find a cure.
And nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated comprehensive cancer center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Welcome back to Hudson Health. I'm Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, facility of RWJ Barnabas Health, and I'm with my co-host.
Hi, my name is Dr. Angel Lazo, and I'm with RWJ Barnabas Health at Exchange Place here in Jersey City. And today we have a special guest, Dr. Emily Martantz, OBGYN specialist. So now in this segment, we're going to talk about after childbirth and after the reproductive phase. And this is the part where the women
The
in our
dreaded
audience.
perimenopause. Let's just go for
Let's
it.
just go for it. Yep.
You know, there's so many women who have their last child and then they won't see us again for 10, 15
Forever,
years.
right?
Forever. And then, they come in with lots of anxiety and what's going on here. So perimenopause refers to the 8 to 10 years before menopause. Menopause is really defined by just not having periods for a year. And the crazy thing is that perimenopause will affect people so differently. It could be something that's a blip on people's radar or something that really devastates patients. Again, like everything in OBGYN, it's super personal, it's super individualized. But OBGYNs are definitely ready and equipped to help patients who are really having a tough go of perimenopause.
What are the symptoms, and as women make this transition, what should they look for?
Sure.
And when do they see an OBGYN or their primary care doctor to refer them?
Absolutely. So that first part is really easy. When should they see an OBGYN? Really every year. So when a patient has their last child, they should continue seeing an OBGYN every year so that we can prepare them for this and that it's not a shock. As far as what symptoms, it really varies. Some patients will have hot flashes. They'll have new symptoms like painful intercourse with vaginal dryness. They'll have irregular periods, so maybe they'll skip a few months here, but then have regular periods for a few months and then not see one for 6 months. Some patients can actually start feeling some mental health issues like depression and sleep disturbance and forgetfulness. So it really starts to wear on certain patients more than others, and we're totally ready to try to make that a softer landing for them.
And again, it's not just, the menopause and perimenopause, but you're talking about, heart health because you lose the hormone influence that's cardioprotective.
Absolutely.
You also have to deal with things like, for example, atrophic vaginitis, and I see that very frequently in my practice, actually, with elderly with urinary tract infections. And that's actually an easy fix, but unfortunately, a lot of patients don't actually know.
Yep.
And then, of course, you have, uterine cancer and so on and so forth. And so elaborate a little bit about that.
Yeah, so that's kind of exactly my point, where patients need to be touching base with their OBGYN yearly, because not only are we going to be screening them for menopause symptoms, but we're going to be concerned with their heart health. We're going to make sure that all their preventative screening mammograms, colonoscopies, all of that is up to date. As far as the menopausal symptoms, yes, something like atrophic vaginitis, we have local therapies, we have systemic therapies, but a lot of those therapies we cannot prescribe until we know sort of the overall health of the patient that we're handling, because there are risks with every kind of medication that you prescribe for a patient.
I personally always get asked, for example, like in my menopausal women that are symptomatic, what about hormone replacement?
Yeah,
Talk about the hormone
so
replacement.
hormonal replacement is a great therapy that's available. The most important part for me is to make sure that the patient is a safe candidate for it. So hormonal therapy, if you're not aware, is basically progesterone and estrogen replacement. It's not to the level and to the dosage of birth control pills. It's much, much lower. The big change that happens in menopause is that basically our ovaries stop producing the estrogen and progesterone it once did, and that's why there's full body systemic consequences. Obviously, the thought behind hormone replacement therapy is, can we, at a low dose, replace those hormones to prevent some of those really big symptoms like hot flashes, atrophic vaginitis, etc. That is a great therapy. Most of the physicians are very comfortable prescribing it, but it has to be to the right candidate and the right patient with the right limited risk factors.
Excellent.
Can you tell us more about some of those risk factors
Sure.
and what the right patient population will be for hormone replacement
So
therapy?
for example, certain breast cancers are fed by these hormones. So if a patient hasn't had an up-to-date mammogram, I'm not going to be prescribing these things. Also, there is some thought that these exogenous hormones could increase the risk of a cardiac event. So unless I know my patient is in good cardiac health, has been checking in with their internal medicine doctor, I'm not going to be prescribing these medications. So again, that's exactly why your relationship with your OBGYN should be lifelong.
Well, something else that comes up is osteoporosis, weakness in the bones, and menopause. Can you tell us more the relationship, and is that something people come to their OBGYN for, or do you send them back to the internal medicine
Absolutely.
doctor?
So when I talk about preventative screening, osteoporosis and bone scans to diagnose that, that's part of our repertoire. Estrogen and the hormones, they're protective against osteoporosis. So when those hormones drop, lots of patients' risk for osteoporosis and fractures associated with that increases. So that's another reason to consider hormone replacement therapy.
And fractures are a big deal for internal medicine because statistically, the mortality rate within the first year, because it's not just a simple hip fracture.
Absolutely.
It's actually the mortality associated with the hip fracture within a year. It's actually very high. It's in the 30s, so it's incredible. So one of the other things that I wanted to talk about, because again, it's not just the osteoporosis, you also have ovarian cancer. Talk to a little bit about ovarian cancer. What are the signs and symptoms? Because that's a scary one for me.
Absolutely. So ovarian cancer is actually, like you said, it's a scary type of cancer because the most common stage at diagnosis is stage 3, which means that the ovarian cancer has been developing for months sometimes. The problem is it's really asymptomatic until at least stage 3. Usually the complaints are very nonspecific, such as some bloating, some weight gain, maybe just some nonspecific abdominal pain. And that's why, again, I'm going to be a broken record, that long-term relationship with the OBGYN is so important, so that when there is a symptom that feels a little off, feels a little bit different, your physician will know maybe it's something we need to explore. And thank God we have ultrasounds that are great at picking these things up.
I can tell you as an internal medicine doctor, for example, what you just described, because the symptoms are really non-specific, but they're kind of GI.
Yep.
So this is something that I'm very vigilant about in my women that are postmenopausal.
Absolutely.
About ovarian cancer is I have my alarm up for these so-called non-specific symptoms.
And I'm going to make another plug for my genetics, because if you have a family history of ovarian cancer, that would automatically make you a good candidate for getting hereditary cancer genetic screening.
Well, I can't thank you enough for having me. We would love to have you again, and unfortunately, we got to cut this segment short, but thank you so much for joining us, and it was very informative.
It was a pleasure.
Pleasure having you, Dr. Martantz. Thank you.
We'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Hi everyone and welcome back to Hudson Health. My name is Dr. Angel Lazo and I'm with RWJ Barnabas Health at Exchange Place. And I'm here with my co-host, Dr. Akunyili.
Hi, Dr. Ije Akunyili. Welcome back. I'm Chief Medical Officer at RWJ Barnabas Health, Jersey City Medical Center. And that was a wonderful, wonderful 2 segments with Dr. Emily Martantz, one of my absolute favorites.
Wonderful.
Yeah.
She really is so sweet and she's easy to talk to. I mean,
Yes.
I can imagine as a patient, she probably gets very deep into it with them because
The patients love her.
she's very much, very, very, very nice.
I like how she took us on the patient journey from pre-pregnancy, really the need to get genetic testing even before pregnancy, the individualized pregnancy roadmap where every woman is different, fetal testing, etc. And then we went all the way to menopause.
Yeah. And again, the advances in her being a geneticist specialist, the advances in screening for some of these diseases is just incredible. Especially women are having babies a little bit older and so on and so forth. So it's very important, like she mentioned, to get to screening. But again, she's not dealing just with, the babies. She's dealing with the moms as well, gestational diabetes and, toxemia. It's just incredible, a lot of the advances that they've actually had.
Yeah, to your point, I think when people hear screenings, they always think it's more of for fetal anomalies, as important as those are, but really even thinking of cancer, sickle cell. There are multiple inherited diseases that really people can be prepared if they knew for the road ahead for the baby and for mom.
Yeah, prenatal care is just elemental. I mean, that's just so essential, especially when it comes to OB, the prenatal care, that roadmap that she was talking about.
Yep.
And again, like you elaborated, that it's actually very specialized to each woman. Each woman has a different need, so to speak, in a different pregnancy.
And we could have a whole show on menopause, of perimenopause and hormone replacement therapy. But the most important thing I really liked what she said was that women should touch base with their OB/GYN. And so many of us sort of have that last baby, like, all right, we're done with that. But it's important to meet every year, everything from ovarian cancer screening to dealing with perimenopause to hormone replacement therapy. I thought that was fantastic.
And I'm especially happy as a primary care doctor as she talked about, the hormone changes and how that affects your reproductive and your cardiac life. It affects, vaginal dryness,
your mental
sex
health.
life, mental health. And I deal a lot with that. So talking about atrophic vaginitis and so on and so forth was essential. So, but we want to thank you very much for joining us. And unfortunately, we got to go today, and we'll be back next week. And we'll see you next time here at Hudson Health.
Thank you for joining.
Bye-bye.